You're having a hard time sleeping, aren't you?
Oh, no, I sleep like a baby. It's everybody else that can't sleep.
Snoring some logs.
Snoring may be a little loud at the house. We're going to get to the bottom of that after this on KMOX.
Listen to that. It's the Hancock household. If you live in Chesterfield, you're wondering if that's an earthquake? No, in fact, it's just John Hancock getting his rest to prepare to come and tussle with me.
Well, you got to get enough sleep at night, Kelly.
Is this really an issue in your house?
Oh, yeah. So my wife's got these little green earplugs that she puts in, and she doesn't like them. They're uncomfortable, and she is not happy with the amount of snoring that's taking place next to her, and I'm fearful that
but you
I'm
know
getting to a
this.
certain age,
You
Kelly,
know this. I would have no
I'm gonna be
idea if I
sleeping in
snore.
the guest room before long.
I have no idea if I snore.
Yeah.
Oh, who's going to tell me?
Well, that's an excellent point.
You know, it's not. I'm sure I do. But I mean, the bad thing about snoring.
The good thing about snoring is it keeps the dog from getting on the bed.
Well, there you
he
go.
doesn't want to listen to that all
But
night.
snoring is a sign that you're not breathing properly. I think when you're sleeping, and
not
sleep
good.
is so important to everything we do in our lives. We are joined on the KMOX guest line by Dr. Joseph Ojile. He's what is he?
He's a pulmonologist, buddy.
He's a pulmonologist. Dr. Ojile, how are you, sir?
I'm great. Good morning, gentlemen. How are you doing?
Good. How'd you sleep last night?
I slept great. I hope you guys did.
Do you snore?
Oh, I do snore occasionally, sure.
So what is snoring? What causes snoring?
Snoring is an easy thing to understand. It's just turbulent airflow. So that the example we use for folks is if you think about water going through the trap under your sink, that noise of the water is turbulent water flow. So all snoring is turbulent airflow going through your throat. The throat's a little narrowed. And certainly this time of year, especially with all the allergies, nasal congestion, snoring increases quite a bit amongst just the population of folks who don't really have a significant problem otherwise. Nasal passages get a little swollen and the airflow becomes turbulent.
It sounds like snoring is a normal thing.
Well, it can be normal in some folks, but the reality is that snoring is one of those signs that causes us to be alert, to perk our senses up and say, like, let's make sure we don't have a problem. So if snoring is consistent, or you're becoming fatigued or tired during the day, or you have someone who's sleeping with you or observing you sleep who says, I was worried you weren't going to take your next breath, or you paused for quite a while, 15, 20, 30 seconds between breaths, that should be a wake-up call, so to speak, to say, I better talk to a physician about this and see if I've got a bigger problem.
So we're visiting with Dr. Joe Ojile. My wife used to tell me all the time that I would have these sleep apnea things, and then I increased my life insurance policy. She doesn't mention it anymore. But
well, just be careful. Does she have a pillow next to you that she's holding?
She does. So the treatment for this, you go in and see yourself or some other specialist, and you're having this. There are tests that you can run to see and evaluate the problem.
That's true. And the great thing now is we do about 60% of our tests at home. They're very simple. They don't require glue. They don't require any sort of invasive testing. It's a couple specialized belts that we put on you. You take the device home. You put it back on at night. You just sleep overnight with it. You bring it back. We can give you an answer within a few days whether we think you have what's called obstructive sleep apnea or your throat closing at night immediately. So it's a great test for that, and especially folks that are younger and have they don't have other serious health issues. That's how we do most of the testing today.
And if you do have sleep apnea, it's a serious problem, and it portends a lot of heart issues, and it's just bad health generally. A lot of people are a little skittish about the CPAP machines, but that's not the only correction for sleep apnea.
Well, that's great summation. And the issue if you have untreated obstructive sleep apnea, especially moderate or severe, it does put you at risk in the future for having high blood pressure, diabetes, a stroke, a heart attack. And if you think at some of the statistics, if you have difficult to control high blood pressure, about 2/3 of those folks have undiscovered obstructive sleep apnea. If you have diabetes and hypertension, both as diagnoses, between half and 2/3 of those folks have obstructive sleep apnea. So it's an important thing to consider for your overall health plan, as well as just health and wellness. We now see a significant number of professional athletes that have obstructive sleep apnea and been treated. And you're right. The positive airway pressure or the machines you're talking about, first of all, the masks are much, much better. Our ability to get people to use them is quite high. But in addition to that, there's quite a few other opportunities, mouthpieces. There's some little nasal Band-Aids that people can use that will act as little valves that will keep the throat open. There are some surgical interventions that some people will choose. We now even have this little throat pacemaker you're hearing advertised for some severe cases called the Inspire, which is an interesting device that right now has a limited utility, but you're seeing more of this sort of creative interventions. And we actually have some positional devices because some people only snore on their back.
Huh. Is this hereditary, this condition, or does it develop just out of nowhere?
We do see it in families because, and one of the key things we'll ask folks is, does your mom or dad or brothers or sisters have this? So there is that anatomical heredity to it. And if you think about, and what we get to tell folks is, in reality, just blame your parents and God. That's the main culprits there. But if your folks have it or your brothers and sisters have it, you do have a marked increase risk to have sleep apnea. So that's right on point. Yes, sir.
And then the last question I have for you, and we're visiting with Dr. Joe Ojile. He's a pulmonologist in Afton. He's an expert in this whole sleep area. Some of us may snore more loudly than others. Doctor, what causes that?
Well, there's several issues that can go into play there. One, it has to do with how narrow the airway is and how much work the individual's having to do to breathe. So if your airway is collapsing quite dramatically, or again, you have more nasal congestion at that time, you're going to have to work a little more aggressively to get that air in and out, and that extra force will generate typically higher levels of volume. And sometimes it's also the sort of staccato nature of the snoring that people complain about. The choking and the gagging, all that kind of stuff. I know these are great things to talk about in the morning.
Yeah, but come on, this has had to have been going on since the beginning of time, right? We've been snoring. Is there something? Is it because we're heavier now? And for goodness sakes, even the dogs snore.
Yeah, well, I think it's entertaining when the dogs snore. My children get a kick out of it. They wonder if we should put them on a device. Their snoring has been reported for the millennia. There's old reports of back hundreds and hundreds, if not thousands of years ago, the snoring being disruptive at night when they're out camping in the desert and things like that. So it has been going on, but the attachment of it to health risk is relatively recent in the last 50 to 100 years. People are heavier today, and we believe that that's exposing more obstructive sleep apnea. It's anatomy first. Weight makes it worse.
Well,
and one of the things that's interesting, if you think about over in countries like
you got to hurry up here. We're running out of time,
okay.
Doctor. And I want to give your Dr. Ojile is in Afton. You can check him out. Give your phone number, Doc.
314-849-1500 or 314-645-5855.
Sleep well tonight.
That's Dr. Joe Ojile. We got to step aside. We'll be back next hour right here on KMOX.